everyone. So as we all know, artificial intelligence has become integral to multiple aspects of life like entertainment, commerce, finance, banking, transportation sector. Similarly, AI can assist personnel in healthcare sector. It can automate various tasks such as administrative workflow, clinical documentation, patient outreach, image analysis, medical device automation, and patient monitoring. So in today's episode, I will discuss the strategies for effectively managing test results to ensure patient safety. Additionally, discuss the benefit of using AI in healthcare and explain how AI can improve healthcare outcomes. Lastly, I will also discuss about the ethical challenges of using generative AI models in healthcare sector. So as we all know, accurate laboratory tests are crucial in healthcare as they aid in diagnosing, treating, monitoring and preventing diseases. So let's take an example. So if a patient presents with symptoms of diabetes, so laboratory tests such as fasting blood glucose are conducted to confirm the diagnosis. So this test must be precise since as incorrect diagnosis could result in patient receiving unnecessary or harmful treatments. So interpreting these results correctly is an important as their accuracy. Misinterpretation can lead to medical errors. So if a doctor misread elevated blood glucose level due to reporting error or misunderstanding, they might prescribe an incorrect insulin dose, which can potentially harm the patient. So the complexity of managing patient information increase as more treatment are administered. So let's suppose if a patient is suffered from chronic disease like heart attack. So over years of treatment, their medical records have grown extensively, which includes laboratory tests, imaging studies and physician notes. So this huge amount of data can be challenging for physicians also to check the risk of overlooking critical information such as drug interactions or change in disease markers. So electronic health records solve this issue by organizing patient information into modules for easily access and interpretation. So a cardiologist can quickly review a patient history of cholesterol level in a graphical format, which make it easy for them to spot trend over time than sifting through table of numbers. This graphical representation can help them to make informed decisions faster and confidentially. So in clinical practices, laboratory test results are rarely considered in isolation. They are integrated with other patients' data for a holistical view. So if a rise in cancer patients' tumor marker levels as indicated in laboratory test may prompt a review of recent imaging studies and reassessment of current treatment plan. So this integrated approach ensures that decisions are based on comprehensive understanding of patient health status, which illustrates the importance of accurately laboratory test and effective management and interpretation of these results within a broader clinical context. So now let's focus on the strategies for enhancing patient safety through optimal test results management. So pathology and medical images are critical in diagnosing and treating patients effectively. So patient safety can be compromised with proper follow-ups on test results. So if a patient undergoes a series of tests from suspected cancer, the pathology result indicates a malignant tumor which requires immediate attention. But due to the communication issue and unclear responsibilities, the healthcare team doesn't review the report promptly and the patient need to be informed here. So this delay in diagnosis and treatment can lead to cancer advancing to the more severe stage, which can impact the patient progress also. So to prevent such type of scenarios, it is essential to have systems that ensure test results are communicated clearly and promptly. So this can be achieved through clear communication, defined responsibilities, strict accountability, and patient involvement. So there is also a requirement of patient safety with advanced electronic test management systems. So implementing electronic applications for managing test results aim to streamline the process, which ensures that results are promptly reviewed and acted upon. So let's suppose a patient being discharged from the hospital after a surgical procedure. So during discharge, several types of tests were conducted to ensure she was recovering well. So traditionally, the result of these tests might come in after her discharge, requires manual tracking, communication efforts to ensure her doctors review them. So this process can be slow and sometimes critical results must be addressed promptly. So with AI-based applications, the system automatically tracks these pending results as soon as possible. Whenever the results are available, and the system alerts the doctor also if a result is critical or required immediate attention. So this alert mechanism acts as a safety net, which ensures that critical information is not overlooked during or after the hospital discharge. So the system also documents when the alert was sent, when the doctor reviewed the result, and what actions were taken. So this documentation is critical for accountability and for improving patient care process. So the system's ability to link sophisticated data also helps to identify patterns or trends in test results. So if there is any noticeable increase in patients with specific abnormal test results, the system can also help to identify this trend, prompting a review of hospital practices or patient treatments also. So in this case, timely notification of test results allow the patient and the healthcare provider to take immediate actions by prescribing antibodies or to treat the infection, suspected infection. So this proactive approach minimizes the risk of complications and support a safer, more effective patient care experience. So by leveraging technology to manage test results more efficiently, hospitals can ensure critical information is promptly reviewed and acted upon, significantly improve patient safety and outcomes. So let's now discuss on the GPT models, like how GPT models can be used to enhance this healthcare outcomes. So healthcare providers are increasingly used a type of artificial intelligence called generative pre-trained models. These models help them to make better patient treatment decisions. These models are powerful because they can analyze large amount of medical data quickly and accurately. So let's take an example here. Imagine a doctor treating a patient with complex health condition. So in the past, the doctor would rely on their knowledge and expertise along with some standard tests to diagnose the problem and decide on the best treatment. So, but with the GPT model, the doctor can input the patient into the system, which includes symptoms, test results, or medical history. The GPT model can analyze this data against vast medical data set to identify patterns or conditions that might be similar. So this can help the doctors to diagnose the patient conditions more accurately, and even they can predict how the condition might progress. So these models are also making a significant impact in radiology. Radiologists examine X-rays or MRI scans for sign of disease or injury. So this skill requires years of training and experience. So by using Gen AI models, they can easily assist by analyzing the images and pointing out areas that need closer examination. So this makes the diagnosis more accurate and speed up the process also. But if Gen AI is helping us so somewhere, there are a lot of challenges and ethical issues also with it. So to integrate these Gen AI models into healthcare, it requires a groundbreaking advancements with the potential to transform the sector. So this journey is full of challenges and ethical considerations that also need careful attention. So the major concern is assurance of accuracy and reliability in AI-driven decisions, especially within critical medical scenarios. So the black box nature of some AI models, which includes generative models, underscore the need for enhanced transparency and explainability in healthcare. So deploying these models touch some sensitive areas such as data privacy, patient confidentiality and potential biasness within AI models. So given that these models interact with suspectable medical information, it is important to prioritize patient safety and data security. So addressing these ethical considerations is essential not only for the ethical deployment of AI in healthcare, but also for maintaining and fostering public trust in this field also. So in Xenon Stack, we build some synthetic data using Gen AI. So Xenon Stack is a technology firm where we develop a cutting edge approach to create synthetic patient records from healthcare data, especially healthcare records. So this technology ensures patient privacy and confidentiality while allowing healthcare professionals to use the data for research, education and decision-making processes. So the synthetic records created by the non-stack powered technology are designed to match the statistical properties of the original healthcare data, which includes outliers also. So this allows healthcare specialists to gain a deeper understanding of diverse disease patterns and address any data bias that may have existed previously. So by improving algorithms fairness, the synthetic data layer helps to promote unbiased decision making and enhance patient care. So accessing healthcare data has challenged researchers and innovators due to the privacy regulations and confidentiality concerns. So the synthetic data layer created by Xenon Stack significantly eased the process. This has resulted in more innovative approaches to patient care and improved outcomes. So now the major question arises, can we trust generative AI? Is it clinically safe and reliable? So trust and validation are crucial for successful adopting Gen AI, especially in medical sector. So ChatGPT responses have shown a vast and unpredictable variations in quality and accuracy. This unpredictability poses a significant challenge to the adoptability of Gen AI, as it is difficult to determine when to trust its responses and when not to, especially when the user needs more expertise to evaluate the accuracy and completeness of the reaction. For example, ChatGPT has known to invent and reference non-existent academic papers, a phenomenon called generative AI hallucinations. It's an issue that can be mitigated using the retrieval augmented generation techniques. Moreover, the discussion of trust raises concern about clinical safety and reliability. So addressing these issues is only possible once we need a medically trained and validated generative AI model. ChatGPT is not specially medically trained. There is an interrelated issue of trust, safety and reliability in its rare medical use by medically trained. I mean a model that has been extensively and specially trained using a corpus of high quality, evidence-based medical tests that sufficiently cover a particular medical area of specialization.